Good afternoon. Yes. I'm really pleased to welcome our distinguished guests, our students, our faculty, alumni, and from wherever you are, welcome for being here. I'm really pleased to be able to welcome you to the third annual Health Sector Leaders Consortium. We're proud to host this from the Carlson School and from the Business Advancement Center for Health. It is a privilege to be with you here today. And we come together, as we're coming together to explore some of the most significant trends and in innovative projects that really will affect the healthcare sector and the future of healthcare, in addition to then grappling with the challenges and the needs that come along with that. So healthcare continues to be a pillar of our economy, and in Minnesota, we remain a national leader in healthcare innovation, research, collaboration, and excellence. And at the Carlson School, we take pride in that, and particularly to play a key role in making sure that we are tackling those complex issues in the healthcare sector, and that we will really help to have an impact on the landscape of healthcare today. So at the core of BACH's work, the Business Advancement Center for Health, is a commitment to addressing those evolving issues and the needs of the healthcare sector. And the Carlson School, we're proud to be able to do that work in order to, because we believe, along with BACH, that improving access and equity and delivering greater value are critical goals. And so we want to convene to make sure that we are helping and assisting and advancing those along with you. So that requires, though, to achieve those goals, collaboration and across disciplines, which is vital and really where BACH excels. Bringing together those voices, those thought leaders, and moving forward so that we can bring together that academic expertise, the industry leaders, the community leaders, to be able to make this kind of partnership and innovation and cooperation that is necessary to increase and create meaningful change. So not only is BACH a hub for research, but it's also, as I mentioned, a center for collaboration in order to bring together expertise from across the whole landscape of healthcare. And through partnerships with academic institutions, industry leaders, community organizations, BACH continues to have the kind of impact that we're really proud to have working here at the Carlson School. From the interdisciplinary health and health data competitions to this consortium itself, BACH's initiatives really embody that kind of collaborative partnership that is so necessary. And so I'm glad to be able to be here to welcome you all and to sing the praises of BACH. As you hear today from the speakers, it's an outstanding speaker lineup. I hope that you'll really take to heart the insights, the expertise, and the inspiration in order to further the conversation, to spark the innovation that we need in this sector. And together, we have that opportunity to really shape the future of healthcare and create health equity, improved access, and greater value for everyone involved. So thank you for being here. And before we move forward, I want to take this opportunity to introduce the founder of BACH, a distinguished McKnight University professor, and today's host for the consortium, and a wonderful resource on the Carlson faculty and in the Carlson community, Professor Pinar Karaca-Mandic. So Pinar, please.
Thank you so much, Jamie, for that really, really warm, wonderful stage setting so excellently for this consortium. And as the founding director of BACH, I am so honored to host this meeting today, and a wonderful evening, and thank you so much for being here and bringing together these 4 distinguished speakers that we have, outstanding lineup, as Jamie mentioned, to share their insights with academia, with healthcare professionals, with invested community members is really the core component of BACH's mission. And I'm really delighted to see all of you here in our 3M auditorium. It's going to be renovated soon, so this is one of our last opportunities to host an event here. And then we will host even more events here after it's renovated. And we also just want to extend our thank you to our distinction sponsor, the University of Minnesota Research Computing in the Office of Vice President Research. And without them, events like that really would not be possible, and we're so blessed to have the university's support in doing these kinds of events. So at the Carlson School, as Jamie mentioned, we really take pride in our work in healthcare. You know, it's we have exceptional education and training opportunities and research programs in healthcare at the University of Minnesota. Many of you are familiar with our signature program, Carlson School's own Medical Industry Leadership Institute, through which we provide a comprehensive suite of health courses at the health sector, both at the graduate level, at the MBA level, but also at the undergraduate level, where we have a business of healthcare minor. And I'm so thrilled to see some of my students here, and you will see some of them here introducing our speakers as well. And so BACH really complements Millie's mission through its dedicated research and outreach efforts. And so some of the things that I wanted to share with you is we actually have 17 tenure-track Carlson School faculty who are doing active research in healthcare, as well as 6 researchers, research fellows for BACH from some of the top universities. And what I did was I just did like a little word cloud of the 17 Carlson School faculty members we have and the type of work that we do here. And the other interesting thing that you will see here, you know, you see these healthcare supply chains, data, drugs, devices, the pandemic, the disparities, recalls, and quality, access, like all of the big important aspects of importance, fundamental pillars of our healthcare system. The other interesting thing to say about these 17 Carlson School faculty members are they span across different departments that we have at the school. So I sit in the finance department. I have other colleagues in the finance accounting department. We have colleagues from the supply chain and operations, from marketing, from information decision and sciences, from strategic management and entrepreneurship. So the point I want to make is that really BACH allows us a forum for these faculty and our graduate students in terms of research to get together and share our insights and really take a more sort of like learned, comprehensive approach to our work rather than staying in our own disciplines. It really highlights this. And I just want to also maybe share some of the more recent select publications that were just that came out in 2024, which will tell you that we really publish on some important thought-provoking projects and topics. So for example, in this forthcoming publication in the American Economic Review, which is the top economics journal that we have, we delve into hospital financing. And we examine the impact of credit supply shocks on patient health outcomes. And you may think, like, what is the relationship? So our findings actually indicate that some financial frictions that hospitals face negatively impact hospital operations, and that also results in implications for quality of care. And this research really highlights how access to credit can influence the quality of healthcare delivery, pointing to some of these significant spillover effects of the credit market frictions on health outcomes. In another recent paper, we present evidence on return on investment on social determinants of health, or you may hear it as SDOH, or health-related social needs, kinds of interventions, programs that are addressing these kinds of initiatives. And so we basically do a comprehensive review of the work and the literature, what's out there, and try to do our apples-to-apples comparisons of what is the return on evidence on food, security programs or programs that provide housing stability and things like that. And we strive to really reach beyond the business school audiences and conferences to engage with the broader communities where our work can really have significant implications. For instance, in 2 weeks, my finance department colleague, Richard Thakor, who is also one of my collaborators, is going to attend the American Public Health Association annual meeting, APHA meeting, where he's going to present on our social bond project. And if you want to read our website a little bit more about this fascinating project, which is in partnership with a lot of community organizations and Minnesota Hospital Association, as well as we talk and work a lot with the MDH, Minnesota Department of Health, and so on. So that's a project funded by the Robert Wood Johnson Foundation, and it really pioneers a new financial instrument designed to secure long-term sustainable funding for community-based organizations and their programs to address social determinants of health. So, again, happy to share much more on it. We've published some on it. And our faculty, as you can see, also publish on some core topics like mental health or women's health. Really, BACH stands out in that intersection of the academia, industry, and the community and serves as this catalyst for collaboration, as Jamie said. And really, this consortium, along with other initiatives that we have, like we have an upcoming interdisciplinary health data competition where students who actually compete in this competition have to have teams that have at least 2 schools at the university represented together. So we have such fun with these kinds of events where we bring students from different disciplines together, working on challenging but pretty cool health data sets. So this year's consortium is going to focus on healthcare trends, and you will see and hear from our speakers. I don't want to take much more time, but basically we told our speakers, come and share with us what is in your mind. What are you thinking about within your organization? What kind of challenges do you see? What kinds of trends do you see? Again, all of these organizations that you see here, they, I'm sure, have a host of things that they're working on, but just sort of like our speakers will share sort of what is sort of keeping them very busy these days. And so we want to use this as a stage-setting event where our students also get to hear what is the cross-cutting problems that we need to think about. So again, we are really excited for the insights of our speakers. And thank you for being here. And before I move forward, I do want to say that we are recording this event. So, and some of the house rules, our speakers will speak, then we'll have a Q&A. We will pass along the mic. Want to make sure, please take the mic before you speak so that the recording is good. And also just be mindful that it is a recording that will be posted. And now we have terrific 2 undergraduate students here to introduce our speakers. We start with Molly Herman and then Will Conlin. And Molly, I think you're first. Thank you so much.